So, hello friends. So, I had an opportunity to do a panel in a toxicology meet on medico-legal sort of a cases in toxicology and how to handle this. So, a little unique topic where generally the forensic specialist would be more enthusiastic. From intensive care perspective, uh, so I had to really put this into a context of the type of cases that we see to generate some discussion points on how we handle medical legal sort of a cases in toxicology. So I will um, just showcase three cases that we have seen and we have sort of managed just to have a context setting as to type of cases. And of course, I would ask in typically our panelists as to what they would do in these situations. So I have some five, six people sitting here. Since it's a talk, I may not be able to deliberate on the sort of a panel, sort of a discussion. So I'll just take you through the cases. So this was a 36, very recently admitted in Manipal ICU. 36-year-old gentleman who is a medical representative, well known to all of us. So basically got admitted with a GCS of 3. So he has no comorbid history, very actively working person, no ethanol, no smoking, nothing. So he gets intubated and mechanically ventilated. So all the investigations, metabolic parameters, imaging, everything were normal. So the question is, would you register an MLC for such patient? Because someone who has no comorbids, of course, when they come, you would think it's a medical case of maybe meningoencephalitis or toxicity, so on and so forth. So, so these are the type of cases that you would get. Initially, you may think meningoencephalitis, or you may think some intracranial event, and you may not necessarily register MLC at the outset, but then as you keep dwelling into the history, then we gathered after 2 days because this patient, none of us knew when we were evaluating him with all imaging and other metabolic tests, because the family initially said they have, no history about anything else. Then they said they found some 3 bottles of phenobarbital. So this gentleman had taken 60 milligram into 300 tablets of phenobarbital, 18 grams of phenobarbital. So history, elucidating the history and trying to get as much information goes a long way. And you can always register MLC in retrospect. So once you have this history, so you will have to register MLC. So the case in point is, although initially you may not have registered, once you have got the history and you're confirmed, then we did a phenobarbital level. So it came very high. So this patient was put on charcoal hemoperfusion. He recovered, extubated. He has gone home now. So you would register an MLC in retrospect in such a case where history has come in little later. So why this is important? We'll talk about certain nuances that will govern our medical legal cases. So this is another sort of a gentleman whom we treated in our ICU. 60-year-old gentleman, quite an affluent businessman connected to sort of a political political honchos, I should say. And his brother himself was a very leading physician, professor in one of the medical colleges. So he basically came to emergency with fulminant hepatic failure, with MODS, with multi-organ dysfunction. So this gentleman came very, very sick. He was referred from another hospital with a lactate of 16, pH of 6.9. Of course, we had to intubate, do all resuscitative measures. So what would you think? 60-year-old affluent man connected to political, so comes with this sort of a multi-organ failure with a fulminant. You would think it is some sort of a viral infection. But then there was a history that was given that he went to an exotic restaurant on an invite from the chef of that restaurant, and he was offered some exotic mushrooms. So he had a consumption of mushroom. After that, he became unwell. So now the question is, would you register an MLC for this situation? So the brother of this gentleman, of course, he was a professor of medicine in one of the leading medical colleges, and so he did request in emergency to do an MLC, and this MLC was done because of alleged mushroom sort of a poisoning this guy had. And this mushrooms was offered to him on an invite by the chef, basically. And then there was a legal petition filed against the restaurant after this gentleman could not survive. He died. So there's a legal petition right now. The case is on this restaurant. So these are the nuances as to the type of cases that we do see where the registering MLC, medical legal case, in these sort of a situations where there is a suspicion around the circumstances leading to the medical conditions have to be sort of thought of, and certain measures have to be put in place to take care of the legal mandates that may be needed. So this was one case in example. So this was the third lady which we treated. So this is a very interesting case. 65-year-old lady. So she was a uh, no significant comorbid. She had diabetes, hypertension, hypothyroid, the usual stuff. Basically, she came with a seizure. So she came with a few episodes of seizure. Then obviously she was intubated, mechanically ventilated. So MRI was normal in this lady. So of course you would do CSF, they were normal. Metabolic parameters were normal. And routine toxicology also was normal. Okay. So then she continues to have, she remains obtended GCS3, then she becomes a brain dead because she loses all her brainstem references. So the question you would ask is, would you do MLC in this? So she's become brain dead. And the second question I would ask is, would this patient go for organ donation? So I have some 5 of my colleagues, trainees of various levels sitting next to me. So I would ask Dr. Sohini Roy. So would you consider organ donation in this situation? Quick answer, because I'm just doing this recording for this talk. She's brain dead, seizure, good sort of a protoplasm, no major organ dysfunction. Very quick, I can't wait for you for ages, man. Yes or no? So she would consider organ donation. Shastri is sitting with me. Manish Shastri is sitting with me. He also says he will do organ donation. Dr. Jacobus is sitting with me. Dr. Jacob says no. Chaitra Patil says no. Pratibha? Okay, so I think we had 2 wrong answers and we had 3 right answers. The answer is no, because you need to know the cause of brain death. And what it turned out to be is she had neuropsychiatric problem and she was taking Amrut Noni, herbal medications. We had done lead levels. Her lead levels came very high. So what she had was a lead poisoning. And why I'm illustrating this case is there was an audacity from our transplant surgeons that they would want to take this for organ donation because patient had consented for organ donation. And I had to put a stop to this patient. Despite knowing that lead levels are high, transplant surgeon was arguing with me that we can do a transplant for this. This is the heights of ignorance and audacity certain surgeons have. They want to argue with an intensivist like me, saying that they would want to do an organ donation. So this is absurd. This is the knowledge that people have to understand, that you cannot do. The premise is you don't know the reason for brain death and you want to do organ donation. And now the lead levels has come high, and a group of certain doctors decide that they want to do organ donation. So this is the knowledge that we have to draw to our ignorant surgeons sometimes. And surgeon had an audacity to argue with me that this case is eligible for organ donation. I had to tell him, please stop it. We'll discuss this later. And we had to put hold. And we did discuss, because I'm part of the Soto State Committee. We put a hold on this, and that's the right thing to do. So please understand, friends. So this is stupid decisions sometimes are taken, and you have to put a stop to certain idiosyncrasies that come out from certain surgeons. Okay. So the medical legal case, what does that mean? So the medical legal case, whenever there is an injury or illness, okay, so, and the investigations suggest that there is a, so it has to come under the legal purview. So then the responsibility has to be fixed. So whenever there is an illness or injury where there are clear explanations that are not available, and investigations suggest that LEAs, law enforcement agencies, have to be involved to fix a responsibility as to the suspicion situation that has led to the injury or illness. So then MLC has to be registered. So where you are not unclear, but you have some suspicion, element of suspicion looming, that some legal entity has to be involved for whatever reason you believe, then MLC has to be done. But before that, the duty of the doctor is to first save a life. And after you put in all resuscitative measures, so there is no reason at this point of time to delay the treatment. Your effort is to first save a life, do resuscitative measures, put in the best efforts to save a life. Then take a detailed history, dwell into the history like a sort of a detective, do a good clinical examination, and then make a decision if this case fits into a situation where MLC has to be registered. And then legal formalities could be done after your initial resuscitative measures have been put in place. And once a MLC is registered, then immediate notification to the police at the nearby station has to be done. And every emergency department is mandated to maintain an MLC register. I'll show you the snapshot of the MLC register that we maintain, where the details of all the case, what are all the details, I'll just show you, have to be entered and maintained. There are 3 copies with the carbon sheets that you write, and 1 copy goes to the station, 1 copy remains in the hospital records, 1 remains in the emergency or with the treating team. So this is the format that you have to put in place. So these are the steps of MLC. So if it is a poison, so because we are talking about toxicology, so obviously, see all the 3 cases I illustrated are all related to sort of poisoning. Okay, so that is the case in example. So when there is a poisoning, obviously a detailed history, like a detective, like a Sherlock Holmes, you need to get information. That's what we did in phenobarbital, and that's what we did in the lead poisoning. So you you need to have the clinical acumen to determine the type of poison that they may have. And once there is some element of suspicion that there may be some sort of a elements that may have been ingested, which makes it suspicious, the simplest thing that you need to do is book an MLC and inform the police. And if patient dies, because see that mushroom poisoning died, so there is a process police have in place, or the legal regulatory authorities have, is they can take dying declaration from the patient. If patient believes that someone has allegedly given something with an intent to homicide, with an intent of homicide, and someone is consumed, so dying declaration, or even if it is suicidal for that matter, so dying declaration has to be taken and autopsy has to be conducted. So these are the little steps, all simple, very intuitive, but these are the steps that one needs to bear in mind when you're dealing a case of poison. And see, this is the norm, this is the gospel. Whenever you have huge question marks about the clinical situation, where you are unclear that there is any medical condition that is explaining, and there is a suspicion that is looming around the situation that has evolved, then medico-legal case has to be registered under section 39 IPC or CRPC code. So that is the section 39 you have to apply. And death certificate, would you issue death certificate to an MLC? So I would ask Dr. Chaitra, would you issue a death certificate after you register MLC and patient has died, like in a mushroom poisoning? Yeah, so you cannot issue death certificate until autopsy. That is a very simple thing that you need to bear in mind. Until autopsy report, death certificate cannot be issued. That is something you need to bear in mind. Lastly, one should not forget, ignorance of law is not an excuse. Just because you say, I didn't know, I thought there may be poisoning, but it didn't look like poisoning, so I didn't do MLC. So is there a punishment for that? I want to ask Dr. Sohini Roy, who is sitting with me here. Is there Shastri? So Shastri feels there's a punishment. Dr. Jacobus. Okay, so everyone believes there is a punishment for ignorance. So that is why we are discussing this. So doctors are meant to know certain legal jurisprudences that govern the registration of MLC. So what are the sections that doctor needs to be aware? So doctor needs to be aware of multiple sections. So there is IPC section 176, which you should all know. If you fail to inform the police of a situation where there is a possible homicidal attempt, then there can be persecution of a doctor. Doctor can be legally reprimanded. And even if patient is died or discharged, then also that notification also has to be given to the police. So AMLC is registered, patient gets discharged, he get like phenobarbital, got better, went home. But police have to be notified the patient is getting discharged. So this is the legal. So now all my colleagues here sitting to me, next to me, would want to know what is the legal persecution you will have. So these doctors should be aware So tell me how many of intensivists would be aware of these sections? I'll tell you none. None would be aware of these sections except people like me or my good friends who have done some medical law. These are the sections intensivists should be aware because we are the ones who are dealing with poisonings, deaths in ICU, and emergency physicians need to be. Maybe more emergency physicians may be aware. Forensic, of course, they all may be aware. Intensivists, I would think most of them wouldn't know, except very handful, countable people. These are the sections that intensivists need to know, and that's the reason of this narrative that I'm doing. So just remember 118, all these sections are related to medico-legal case that we register. And very simple to remember, all these are related to doctors concealing the information, fabricating the information, giving fake certificates, and not suspecting there is some homicidal attempt, or trying to palm off the possibility of offense to someone else, or implicating or with someone else with incriminating documents. All these are governing the sort of MLC cases for which doctors may get entangled. So you need to remember these sections. So what does IPC section 118? 118 deals with concealing info, where it may be medical caregiver who is concealing the info of probable criminal sort of a situation that may have caused the death of a patient. And he's trying to prevent them from getting punished, avoiding sort of a punishment. It can be act of omission. So the medical caregiver can say it is an act of omission. No, there is no pardoning for that. Even if it's an act of omission, you will be reprimanded. Or it can be act of commission to save someone else. So I can give a simple example where there is maybe poisoning. Family comes, sir, MLC madbedi, don't do MLC, sir. He was very depressed. And you say you don't do MLC, you can be put in jail because they might have killed him by giving him poison. That can be omission or commission. So look at the imprisonment, 3 to 7 years of imprisonment with fine. All these IPC sections I showed you come with imprisonment and fine. Please remember, don't conceal any information, and you document everything, and don't go to save anyone. MLC means it has to be MLC. Every week I get a request, sir, can we prevent MLC? Can we prevent MLC? No, we cannot prevent. If you prevent, doctor will be put in jail because you are trying to protect someone else who may be involved in the offense that has been created. We have seen this every time, even ethanol. Today, as I'm giving this talk, one fellow is come with ethanol intoxication with a GCS of borderline GCS. Family tells us, sir, don't put ethanol, sir, insurance barala. If you don't put and he dies, who knows, he may have been poisoned with something. So these are all simple things. Don't take a chance by hiding or protecting anyone because you will not be protected, you will be put into jail. What is section IPC 176? 176 is where doctor or a care provider has done an omission to give notice to the police or give adequate information to the police. Doctor is failing to give information to the police about the circumstances that may have led to the death of a patient. What is the imprisonment? It can be 1 month and a fine. And what does IPC section 177? Again, giving false information. So patient may come with overdose. You may say he's a depressor. He has taken 2 tablets. The sodium was low. That's why he's low. So giving this false information can land you in jail if it is proven. And you will have always fine. There's always a fine associated with the jail. What about IPC section 177? Again, giving false. See, this is interesting. You are giving false information to make sure that this false information given to them is making cops to cause injury to another person. Keeping another person in mind, you are giving information to incriminate another person. This is also comes under IPC 177. Again, the punishment is jail and a fine. But these are interesting IPC sections, 191 to 197. So 191, 192, 193. All this, although it don't get too much overwhelmed, all this 190 to 197 deals with false records, fabricating documents, so on and so forth. So section 191, you go to the court, doctor can be called to the court and you give false statement under the oath you take. So that is called perjury. Section 192, fabricating evidence. Very easy for doctors to get involved in this. If there are a lot of injuries, you just minimize the injuries and write. and say that you are unaware and miss out on certain elements of intoxication that may have happened, and giving fake documents, all this come under 192. Section 193 is the punishment for 191 and 192, which is imprisonment up to 7 years and fine. So, and section 194, see, this is very interesting. You have given false evidence to incriminate someone, which has led to the capital punishment of that person. So, you have given some information saying there is a history that was given that this gentleman had given this person and patient died. And somehow the court, whatever is circumstantial evidence, he is hanged. And then that was a false evidence. And then you get information later that it was a false. That can lead to the same punishment, life imprisonment for a doctor if he has done that, which has led to a false capital punishment. 195 is you have given false evidence which has led to another person landing up in jail for 7 years. The punishment for you, that if it is proven, is again a jail of the same life term or 7 years. So be very careful. Don't, basically, this is all conniving and colluding with someone who has done a crime. If you do that, there is a very high possibility doctors can end up in jail. And 196 is false evidence knowingly, it's a false evidence telling in the court, in the legal proceedings, you give a false sort of a version or false statements. And 197 deals with issuing fake certificate. This is very commonly done by maybe some of the healthcare personnel, that giving fake certificates for whatever reason, so suppose there is something happened and you give a leave certificate for possible incriminating person, probable person who is involved in the crime, and telling I was not well, I was sitting at home and I was not there when this happened. All this can lead you into a problem. So giving fake medical certificates saying that he was admitted, you can give a fake certificate saying he was admitted in my small hospital with loose motions, whilst he was involved in some crime outside, that can land you in jail. So giving fake certificate, either medical or legal, is problem. And IPC section 201, so that is 192 to 197, all deals with fabricating evidence, concealing the evidence, all this. IPC section 201 deals with destroying the evidence. So you may have written something in your notes and trying to get it to disappear or destroying the evidence. That can lead to jail term of 1 to 7 years. And IPC section 203, so doctor or healthcare knows that or believes that offense is committed, and then he knows that offense is committed, but you are giving false information to magistrate, police, or public servant, that can also lead to the jail of 2 years. And IPC section 204 deals with, again, destruction of electronic evidence, mainly talks about manipulating the electronic evidence so that you are preventing the court from accessing certain electronic medical records. That is also comes under IPC section 204, which can lead to jail term of 2 years. So these are all the sections that govern the proceedings of maintaining the sanctity of our healthcare delivery. So basically, the dictum in my whole narrative, if you see, just stick to facts, be honest, and do the right things. Don't connive and collude with the patient attenders in especially a homicidal or suspected homicidal or suicidal, any of these deaths where there is a MLC registered. Don't take any chance. Don't try to conceal information. Don't just unnecessarily not write ethanol as a possible intoxication, because these are all the social issues that will add up in a medico-legal case, and that may all have different ramifications. Many a times, what we do is, just to protect the patients, we fail to write that there is a history of ethanol. And most of these crimes tend to happen with ethanol also as one of the ancillary sort of a dimension in most of these crimes. So just not writing that no alcohol intake may absolve certain crime that may have been committed. So, and you may be helping the person who has done the offense. So please don't do that, especially in an MLC case. And we deal with, as I'm giving this narrative, we have a young fellow who is come with ethanol intoxication with GCS of 6, and MRI shows some hypoxic. We don't know what has happened. He may have been strangulated when he was alcohol. He was intoxicated for sure, but that cannot explain why he's not waking up now. So, and if you write, this patient does not take alcohol, then you are really doing a crime, because you are concealing some sort of a very crucial information that may have led to this problem. So these are some of the situations. Be honest, be ethical, and put in the facts, and don't hide any information when it's MLC. That is the take home message. And this is just a MLC register in our hospital, just to showcase, I'm sure. So most of you would be doing this. So these are all the information that we write with carbon sheets. So, all those what I mentioned would be written, and there'll be 3 copies. One will go to the police, one will be in the hospital records, one will be in the, so these are the sort of a MLC register that we maintain in our hospital. You can see MLC intimation, and generally it comes as a book where carbon sheets are kept and written of this nature. Okay, friends. So hope that was useful. So thank you, everyone. So I request you all to submit your valuable work to Journal of Acute Care and visit my website to rehear to this lecture. Thank you. Thank you, everyone.